Hey there, it's Dr. Cammisa. Welcome back to our video series. And today we're talking about a hydro nerve dissection. What the heck is that? I'm going to explain that to you with my detailed anatomical drawing here. So if you're new to our channel, hit the subscribe button, turn on your notifications. But stay tuned. I got lots to share about hydro nerve dissection and how this can affect one of the major nerves in our body, sciatica. So when we're doing prolotherapy, you use 50% dextrose. But today we have several cases that we're doing, which is a hydro nerve dissection. I'll explain that in a little bit. But how we make that is just a straight, you can see on here, this is a 250 ml bag of 5% dextrose. So it's already pre-made with saline. So it's a combination already of saline solution and dextrose made to a 5%. And so we use this with no lidocaine when we're injecting around a nerve to free that nerve from a scarred location. Hey there, welcome back. So today, hydro nerve dissection, and what is that? And so we're going to talk about this picture right here. Actually, we have forgot to put on that, but we have the sciatic nerve drawn in here. And the sciatic nerve, Piriformis Syndrome, that's when you're going to get pain going down the leg, into your thigh, into your leg, into your foot. And what happens when it's a chronic situation, if there's been trauma to the glute area, we have the muscles here. So we have a muscle on top, which would be your glute. And then we have a muscle below this, which would be your piriformis. The purple here is the sciatic nerve. Now the sciatic nerve sits, if my two hands are the muscles, the sciatic nerve sits in this fascial plane here, where we're supposed to have some hydration, so that if you were to sit on top of this, the nerve would actually roll out of the way. But as this becomes a chronic situation, the nerve in the fascial layer scar. And so what happens, that nerve gets stuck. So when you sit in the plane, you sit in the car, you go for a long drive, or you're at the desk, you put pressure on the nerve. And so what happens, that nerve sends that numbness, tingling, burning sensation down the leg, into the thigh, into your foot. And so what we do with this, a hydro nerve dissection injection actually, is that we're going to take a needle, and you're going to see a live demonstration of this today. We're going to take a needle and we're going to put fluid underneath the nerve and on top of the muscle. And then we're going to come in and do the same thing above. So we're going to, the blue is the hydration, and that's what we're using, the 5% dextrose. And we're going to free that nerve up so that nerve has some breathing room and can start to slide when your muscles are contracting back and forth. So stay tuned for the live video of this.
See the angle showing up in the bottom of the screen, right?
So there's the needle right there coming in.
Yeah. Okay.
So there's the projection of the needle right here coming through.
Yeah. 1, 2,
on the target, on the sciatic nerve.
Yeah. And that little square is the tip of the needle.
You can see it coming in.
Yeah. There you go. I want to be right there.
Got enough, or you need a longer?
No, I think it's good enough. Okay, I'm going to go from this side first. Then I'm going to angle a little bit. And then I'm going to change the angle again. There you go. Right there, because I want to be right above beautiful. It. Yeah. Right above the sciatic nerve, but I don't want to touch the sciatic nerve, so it's right there. Well, that's a good thing about the magnetizer, because anytime you're injecting, anytime there's fluid, you start losing the image of the needle, and that's what the magnetizer shows you exactly. See the tip in the little square? It shows you exactly, where you're going to be. And that way, you know you're in that area without going too deep or too superficial. 5, 4, 3, 2, 1, coming a little out. Excellent.
Fabulous.
Now let me see if I can go from this little angle and get a little, yeah, look at the nerve right there. Separated already. That's what we want to see. We want to see a little bit of fluid under it. And that's it, separated. Excellent.
We're good.